So good evening, everyone, and thank you so much for tuning in tonight. My name is Julia Weedle, and I'm the Communications Specialist at Public Health Sauk County. We have a great webinar put together for you tonight, and we're really excited to provide a space where we can discuss a variety of topics that are pertinent to sexual health. So in this webinar, we'll be covering healthy relationships, STIs, and patient rights and confidentiality. Before we start, just so everyone is aware, this meeting is being recorded. So by remaining in this meeting, you consent to being recorded. Another thing to be aware of is that participants are on listen-only mode. So you can feel free to add questions to the chat throughout the presentation. Just make sure that those questions are being directed to chat questions. So if you can reference the photo at the bottom of the screen here, where it says everyone, you should be able to select like a little drop-down menu and make sure that your chats are being directed to chat questions. We do have time set aside at the end of the presentation for Q&A, and that will be facilitated by Public Health Sauk County's Deputy Director, Jennifer Weitzel. And one last thing before we officially start is that we will be giving instructions to access the post-event survey at the end of the presentation. There will be a QR code option as well as a link. So please make sure that you either have your phone on hand to capture the QR code or that you're able to jot down the link when that time comes. So we have three presenters tonight. We have Healthfirst Chief Executive Officer, Jessica Scharfenberg, who will be discussing sexually transmitted infections. We have Public Health Sauk County Public Health Nurse Haley Seehoff, who will be discussing Gardasil as well as patient rights and confidentiality. And we also have Hope House Youth Educator Amanda Deppy, who will be discussing healthy relationships. And with that, I will pass it over to Healthfirst.
Good evening, everyone. Thank you for attending. My name is Jessie Scharfenberg. I am the Chief Executive Officer at Healthfirst. We are a nonprofit reproductive health clinic that has 9 locations in central Wisconsin, including in Sauk County. Tonight, we are going to talk a little bit about sexually transmitted infections. Next slide. So what is a sexually transmitted infection, or STD or STI? So a lot of individuals use both the terms STI and STD. The nomenclature had changed several years ago from disease to infection. That's where we have the I instead of the D. STIs are infections caused by bacteria or viruses, and they are spread by oral sex, penile to vaginal sex, anal sex, skin-to-skin contact, sharing needles, and from mother to infant. There are over 20 million new cases per year, and about half of those cases are in individuals between 15 and 24 years of age. Next slide, please. To put that into perspective, every 3 seconds, someone between 15 and 24 years of age contracts an STI. Next slide, please. As we're talking about STIs, prevention is the key. So the only 100% way to ensure that an individual is not going to get an STI is abstinence. So not having oral, vaginal, or anal sex is the best way to protect yourself. However, some STIs are transferred without any form of intercourse through blood contact or skin-to-skin contact. We encourage anyone who is going to be sexually active to use a barrier method. Barrier methods are condoms. There are both internal and external condoms that individuals can use during intercourse to prevent the transmission of STIs that are transmitted through fluids. Next slide, please. So how do you know if you have an STI? Most people have no idea they have an STI because they don't have symptoms. So getting tested at a health clinic is the best option for an individual to tell if they have an STI. If you do become infected, symptoms may appear right away, but it could be weeks or months or even years before an individual has any symptoms. Also, the symptoms may come and go, but you can still infect others even when you don't have symptoms. We talk a lot about that, especially with chlamydia, which we'll get into a little more in depth here shortly. Chlamydia is usually asymptomatic, but even though individuals don't have symptoms, they can readily spread it during their sexual intercourses. Next slide, please. Here are some common symptoms for both males and females when they have an STI. So females would be itching, bad smell, or unusual discharge from your vagina or anus, pain or discomfort in your lower abdomen, bleeding from your vagina between your menstrual periods. For males, usually a drip or discharge from your penis, itching, pain, or discharge from the anus. For both males and females, lumps, bumps, sores, or blisters near the genitals, anus, or mouth, or burning or pain when you urinate. However, a majority of the time, you're not going to have any symptoms if you have an STI. Next slide, please. Next, we're going to go into some treatment and facts about the different STIs. Next slide, please. So, as I had mentioned earlier, STIs are either bacterial or viral. Some things to remember when we're differentiating between the two: bacterial infections are treatable and curable. Viral infections we can treat, but we cannot cure. So an individual who has a viral infection is going to have that permanently, but we can provide treatment to help with the symptom management. Those that are bacterial, we can provide an antibiotic to remove the infection completely. However, some of the STIs, specifically around gonorrhea, we are seeing bacterial or antibiotic resistance to the bacterial infection, which is making it harder for us to treat and cure. Next slide, please. Common STIs are chlamydia, gonorrhea, genital herpes or HSV, genital warts or HPV, HIV, syphilis, trichomoniasis, and pubic lice. Next slide, please. So this is a very, very busy slide with lots of recommendations, but these are the general STI testing recommendations for individuals. So if an individual were to have unprotected sex with a partner, you're not going to know immediately if you have an STI. We encourage individuals after unprotected sex to wait 2 weeks and then come in for testing. When you are symptomatic, itching, burning, discharge, lumps, bumps, blisters, some of those signs and symptoms that we went through, make sure you go in to have a test completed. Adults and adolescents from age 13 to 64 should be tested at least once for HIV, more often if they're symptomatic or partake in high-risk sexual behaviors. All sexually active women younger than 25 years should be tested for gonorrhea and chlamydia every year. And then individuals or women 25 years and older with risk factors such as new or multiple partners or a sex partner who has an STD should also be tested every year for gonorrhea or chlamydia. Again, we want to make sure, though, if you are symptomatic, we want an individual to be tested more regularly. Everyone who is pregnant is going to be tested for syphilis, HIV, hepatitis B, hepatitis C, gonorrhea, and chlamydia, and those may be repeated throughout the pregnancy. All sexually active gay, bisexual, and other men who have sex with men should be tested at least once a year for syphilis, chlamydia, and gonorrhea, and more often if they have multiple or anonymous partners, at least once a year for HIV, and again, may benefit more frequently, as well as hepatitis C if living with HIV. Anyone who engages in sexual behaviors that could place them at risk for infection or sharing needles for injection drug use should get tested for HIV at least once a year. And then people who have had oral or anal sex should talk with their healthcare provider about throat and rectal testing options for gonorrhea and chlamydia. Next slide, please. Chlamydia and gonorrhea testing is done with a collection method of via either urine or a swab. Testing sites include the vagina, penis, and anus. Gonorrhea can also be tested for in the throat, and we are seeing trends that individuals are more likely right now actually to have gonorrhea in the throat than in the vagina or penis. Next slide, please. Genital herpes or herpes simplex virus or HSV, you may hear them termed all of those. HSV is caused by the herpes simplex virus 2, and it causes blister-like sores. So those sores are going to be in the genital areas, whether that is on the vagina, in the labial area, or actually on the penis. It can also be on the inside of the legs or near the buttocks. HSV can be spread even when using a condom, as the condom is only covering a small area. And if there is an actual blister or sore outside of the area that's covered by a condom and there's skin to skin contact, it still can be spread. So with the treatment for herpes, there is no cure. So once you have herpes, you're going to have it for life. You most likely will have different outbreaks throughout your lifetime. We can prescribe antiviral medications that will help control the reoccurring outbreaks, and they can also clear up the painful sores. But it's extremely important to remember that this is one of them that you will live with for the rest of your life. Next slide, please. So herpes testing. For an individual to have the most accurate herpes testing, an active herpes outbreak is actually needed for the testing. So a provider would actually want to take a swab from the blister so that they can have the fluid to confirm if it is indeed HSV2. There are some individuals who have heard of blood herpes testing, but without an actual outbreak, we don't know if it's herpes as in cold sores or if it's actually genital herpes. So that's why we recommend for an individual with an actual outbreak to be tested for herpes. Next slide, please. And this goes into a little bit about the cold sores. So herpes simplex virus 1 is, or HSV, is what we commonly see as cold sores on the mouth. Up to 80% of the population has the virus. However, what we are seeing is HSV1 can be transmitted to the genital area through oral genital sex. And about 40% of the cases of individuals coming in with a herpes outbreak in their genitals is actually caused by HSV1. Now, HSV2, which is herpes simplex virus 2, which we often call as genital herpes, up to 22% of sexually active adults actually have it. Most people with herpes will not have symptoms and therefore are not aware that they have it. So remember, you can still spread or contract an STI when there aren't symptoms. 50% of people getting herpes get it from partners who are unaware that they have it. So it's important that we know our own STI status, but it's really, really important as individuals who are starting to partake in sexual activity to have those conversations with your partner and ask their STI status as well so that you can protect yourself. Our clients that come in, and when we do education in the schools, we always tell students that if they aren't ready to ask their partner what their STI status is, they aren't ready to have sex. And if an individual is not going to share their STI status with you, you shouldn't be having sex with them either. Next slide, please. HPV, or human papilloma virus, is another viral infection. We often see that as genital warts. However, it also causes several different types of cancer, including cervical, vaginal, vulvar, penile, anal, rectal, and oropharyngeal. Oropharyngeal is actually mouth and throat, and we're seeing a huge uptick in mouth and throat cancers actually caused by the HPV virus. There are over 100 different strains. However, Haley in a little bit is going to talk to you guys about a way to prevent it. Next slide, please. With the genital warts, they're caused by the HPV virus. It can be spread even when using a condom again, because a lot of times those wart outbreaks are outside of the area that is covered by a condom. So we have that skin to skin contact with the sore. HPV is caused by a virus, which again means there is no cure. We do have some treatment options. Obviously, if it turns into a cancer, there's treatment options that way. But if we're just dealing with the actual genital warts, some of the warts can be dissolved with special medication or frozen off with a special chemical. Some of those on the call probably have experience with maybe like a plantar's wart or a wart on your foot or hand, and you go into the physician's office and they actually freeze that off. That is the same, that process that is used to freeze off genital warts as well. Next slide, please. HPV testing. So we can test for HPV if you have an active wart outbreak so that we can actually test the cells from that area. There's also HPV testing that can be done, and unfortunately, it's only for women. And we take tissue samples during a pap smear in which those are sent in and tested to see if the HPV virus is present. Unfortunately, for men, we don't have a test at this point in time for HPV unless there's actual genital warts. Next slide, please. HIV and AIDS is the next one that we're going to go into. Again, HIV is a virus. It's something that you're going to live with. So HIV is human immunodeficiency virus. It's a viral infection that destroys the body's defense system or your immune system. AIDS is the acquired immunodeficiency syndrome. It's a diagnosis that occurs once the HIV virus has actually destroyed the immune system. There is no cure. There are many medical treatments that individuals can take to suppress the symptoms. There's also prevention, which I think is something we should really be talking about with HIV, especially since we know that it is spread from mother to baby through needle sharing and is prevalent. So not only can an individual use a condom, but there's a medication called PrEP that individuals can take on a daily basis, and it actually prevents you from contracting HIV. So an individual could be taking it, could have sexual intercourse with another individual who actually has HIV or AIDS, and it will prevent them from getting it. It is huge breakthrough science. It's been around probably about 5 years now, and it's becoming more and more accessible to individuals so that we can actually prevent the transmission, which is awesome. Next slide, please. So how do you get HIV? And I talked about this a little bit. Blood, semen, vaginal fluids, and breast milk. Unfortunately, people who have another STI are at a higher risk for contracting HIV during sex with an infected partner. And that's because your body's immune system is already trying to fight off the other infection, that it makes it more susceptible to the HIV infection. Next slide, please. How do people know they have HIV? Many people do not know they have it. It's usually a surprise when an individual comes in and they test positive for it because they haven't had any symptoms and they're just coming in for routine screening. Symptoms might not appear for up to 10 years. So an individual could be living with it and actively transmitting it during sexual intercourse if they aren't aware of their STI status. Some people may feel and look healthy for years. However, even when you're feeling and looking healthy, if you have the virus, it is still possible to infect others when you're asymptomatic. Next slide, please. So when we make that transition from having HIV to AIDS, so AIDS is the syndrome when your body is really broken down, your immune system. Some of those symptoms are extreme weakness and fatigue, rapid weight loss, frequent fevers with no explanation, heavy sweating at night, swollen lymph nodes, chronic diarrhea, minor infections that cause skin rashes, could be on the mouth, genital, and anal sores, white spots in the mouth or throat, a cough that won't go away, and short-term memory loss. Next slide, please. These are just a few statistics of HIV and AIDS in the United States. There's 1.2 million people living with HIV in the US. And there's about an estimate of 168,000 do not know that they have it. There's roughly 36,000 new infections every year. Thousands of teens in the US become infected each year. There are roughly 15,000 AIDS-related deaths annually, which actually is doing quite well compared to our 1981 statistics when there was over 700,000. So we're doing a great job at early identification and then also treatment and helping individuals live longer lives if they do have HIV and AIDS. Next slide, please. HIV testing is performed via a blood sample. There are many different options. Sometimes you actually have to go in for a blood draw. Other clinics have the opportunity to do a rapid finger stick. So I'm sure many of us know individuals who have to check their blood glucose with a finger stick on a normal basis because they have diabetes, we actually do a rapid finger stick like that, and we can have results within 20 minutes for an individual to see if it is reactive for the HIV virus. If it is reactive, and then we go to a blood draw for confirmatory testing at the Wisconsin State Lab of Hygiene. Next slide, please. Syphilis is a bacterial infection, which means it can be cured and treated with an antibiotic. There's 4 different stages of infection. The dosing on the treatment is going to be correlated with what stage of syphilis someone is in. It can be cured in any stage. However, it's important if an individual is in some of the later stages of the infection, serious health problems can occur, such as brain damage or damage to our organs. That's not something that you get back after you are treated and cured of the bacteria. Next slide, please. With the stages of syphilis, we have latent syphilis. There's no signs or symptoms. Tertiary syphilis is associated with severe medical problems, including our heart, brain, and organ failure. We have primary syphilis. That is when we usually see what we call a chancre, which is like a large sore or blister in the genital area. It could be on the mouth or in the anus. And then secondary is when we have more of a systemic reaction with a rash over the body. Next slide, please. Syphilis testing is identical to what we do for our HIV testing. We now do have rapid syphilis testing, which is wonderful. So we can have results in 20 minutes. Again, if the rapid result is reactive, then there would be a blood draw for further confirmation. Next slide, please. Trichomoniasis, or trick, is what we often call it, is actually caused by a parasite. This is a newer STI, but we are seeing the cases rise dramatically. It is treatable and curable with an antibiotic, even though it is a parasite. It can cause permanent damage to the reproductive health system, though, because a lot of people don't know that they have it. About 1 in 5 people get reinfected again within 3 months after treatment. And a lot of that is because they don't get their partner in for treatment. And that's why we have to make sure that your sex partner gets treated and follow the direction provided by your healthcare team. And that's with all of the STIs. If you are sexually active, making sure that your partner knows if you have an STI so that they can be treated as well, and or their partners can get treated as well. Because if we treat you and cure you of chlamydia, but your partner still has it, they're just going to give it to you again, and you're going to become reinfected. So honest and open communication is extremely important when you have an STI. Next slide, please. With the trick testing, testing sites include the vagina and the penis, and it's actually a swab collection method. A lot of clinics can get you results the same day because it's actually looked at under a microscope, and they can actually see the parasite swimming around. So in the bottom of the screen, you can see these little purple dots. They're actually the parasites that are swimming around that were collected in the fluids. Next slide, please. Pubic lice or crabs are caused by a parasitic insect, and that is curable with over-the-counter lotion or mousses. Next slide, please. So what happens if you don't get treated? So we know a lot of the STIs don't have any symptoms, or it may be months or years before you actually have any symptoms. When you have those STIs and they are in your system, they are doing damage to your reproductive health organs. So some of the issues that we see when an individual has an STI for a long time and isn't treated is potential infertility, which is unable to have babies, cancer when we're talking about the HPV virus, long-term pain. You can pass the disease from mother to baby. And then with some of our diseases such as syphilis and HIV, death is a possibility. Next slide, please. I wanted to bring up the opportunity of family planning only services. So family planning only services, or FPAWS as we like to call it, is actually a Medicaid program from the state of Wisconsin. If you are a Wisconsin resident and a US citizen and make less than $21.65 an hour working full time, you qualify for the program. This program is wonderful because it has a higher income threshold, and it also only takes into consideration your income as an individual. So it is not based on a household income. The program covers at no cost to the individual birth control, condoms, annual exams, STI testing and treatment. Anything reproductive health related is going to be covered by the program at no cost, as long as you meet that income threshold of $21.65 or less an hour. For individuals who have high deductibles or have co-payments and commercial insurance, even though you have that, you still can qualify for the program because it's solely based on your income and your residency status. So that's a great opportunity for individuals who have those high deductibles and would be paying a lot out of pocket. They can qualify for the program and actually receive the services for free. Family planning only services is open to anyone in the state, including minors. So young individuals can be on the program as well to cover reproductive related services. Next slide, please. So Healthfirst again covers 9 different counties. We're in Adams, Sauk, Juneau, Portage, Marathon, Lincoln, Langley, Taylor, and Wood County. Our 1-800 number is there. We love to answer questions, schedule appointments. We also do a lot of education in our local schools on STI prevention and then also pregnancy prevention and contraceptive methods. Our services that are offered are full spectrum reproductive health care, including annual exams, contraception, STI testing and treatment, education, pregnancy testing, and referrals. Next slide, please. All right, I am going to introduce Haley Seehoff. She is a public health nurse from Health Sauk County, and she's going to give the next segment of the presentation.
Good evening, everybody. Like Jesse said, I'm Haley Seehoff, one of the public health nurses for Health Sauk County, and I will let you go to the next slide, Julia. So I'm going to talk a little bit about Gardasil. Jesse had talked about HPV and how that there was a way to prevent it. Gardasil is a vaccine that prevents the cancers caused by HPV. It protects against abnormal cells that can lead to cancer, also known as precancers, and the lasting effects of testing and treatment for those cancers. It's made from one protein from the virus, and it is not infectious, meaning that this vaccine cannot cause HPV infection or cancer. Since it was introduced in 2006, infections with HPV types that cause most of the types of HPV cancer have dropped by 88% among teen girls. Research has also shown that fewer women are developing cervical precancers. This vaccine provides long-lasting protection, and there is no evidence that the protection decreases at all over time. Next slide, please. So Gardasil can be given anywhere between ages 9 and 45. We recommend starting at age 9 for a few reasons. So if you're starting at age 9, it's only 2 doses. So as long as it's given before age 15, it's 2 doses versus over 15 years old, you would need 3 doses. But another reason for starting at age 9 is that they need fewer vaccines at an appointment. If you wait until ages 11 to 13, there's other vaccines that they would be needing during those visits, like the meningitis and some of those things. So it can be helpful for many reasons. And then they're also protected, hopefully before being at risk and before potentially being exposed to HPV. Also, parents can ask for that vaccine at 9 years old. So we hope that most clinics are making this their standard practice to start it at age 9. But if they're not, as a parent, you can advocate for your child and ask them for it because they can get it starting at age 9. Next slide, please. So next, I'm going to just chat a little bit about confidentiality. So there are laws in place that allow teens to seek reproductive health care anonymously. services would be things like getting oral contraceptives or birth control, natural family planning services, family planning pharmacy visits. So like going to just pick up their medication from the pharmacy, tests and treatment for STIs. So all of those things are allowed by teens on their own without a parent's consent. There are a few instances when confidentiality can be broken and needs to be broken by a provider. These things would be if the provider believes that the minor did not consent, was abused by a caregiver, was unable to communicate willingness, or is worried that the minor is being sexually exploited. If a provider believes any of these things are happening, they're going to tell the teen that they have to break confidentiality and that they're going to have to tell someone, because most providers, I actually can't think of any that wouldn't be, are mandated reporters, and that's kind of what comes into play with the confidentiality. Next slide, please. So some sexually transmitted infections are reportable diseases. So what this means is that whoever conducted a STI test, like it could be their primary care doctor or Healthfirst, for example, they must report a positive test to the local health department. So many of the infections that Jesse had talked about, including gonorrhea, chlamydia, syphilis, and HIV would be reportable. So whatever lab completes that test automatically sends the local health department a copy of the lab results. So what happens when we receive a report of a positive STI would be a little bit of follow-up from the public health nurse. This is not meant to be anything scary. It's just to make sure that whoever has tested positive gets the correct treatment. So this phone call from the nurse has to be with that teen. And this goes back to that confidentiality. Because they are legally protected to access these services on their own, we have to talk with the teen. This is often really hard for parents because someone identifying as a nurse is calling and wanting to talk to their child about something, but they won't tell the parent what it's about. So I know it can be really difficult, but these laws in place make it so that we have to talk with the teen. So the conversation just involves talking about appropriate treatment, making sure that they understood what medications they were supposed to take and how to take it, making sure they take all of the medication, and then a discussion about safe sex practices, talking about birth control for both males and females, talking about really just any questions they may have. And then lastly, about partner notification. Jesse talked about the importance of all partners being treated, and that is always part of our conversation. So I always let teens know that they can let the partners know on their own, or I can notify for them. I never share who gave me the partner's name or information. It's always kept confidential, but then I can help those partners get in for testing and treatment and make sure that all of that is completed so that it stops being spread. We always encourage teens to have an open discussion with their parents, but it is ultimately their decision because they have rights to confidential reproductive health care. Next slide, please. So at Public Health Sauk County, we always have free condoms in our waiting room. You don't have to ask for them. You can just come in and grab them. We have HPV vaccines. So we have Gardasil. You can always call us and we can set up an appointment for that. Connections to HIV care. We have nurses available Monday through Friday. In the mornings, we can do pregnancy testing. We can do that family planning only services enrollment that Jesse was talking about. We can also do Badger Care Plus Express enrollment for children and pregnant women. And if individuals are pregnant, we also have home visiting services for pregnant women and children. And with that, I will hand it over to Amanda from Hope House to talk about healthy relationships.
Hi, my name is Amanda Deppie. I am one of our youth advocate and educators here at Hope House. My pronouns are she, her, and hers. So thanks for watching this video today. I'm here to talk about healthy relationships, but I want to briefly cover Hope House services. So anyone impacted by dating violence, domestic violence, sexual assault, human trafficking, elder abuse, financial abuse, they can receive our services, which are free and confidential. So anyone calling our helpline, sending us an email, we don't share or disclose that information with anyone else. So if you're residing in Sauk County, Columbia, Juneau, Adams, or Marquette, we can provide you with outreach services as well. And sometimes we do have individuals traveling through the area, maybe on vacation, or like the J1 program in the Dells. We'll provide them with services and then connect them to resources when they go back home. Next slide, please. So you see here our teen equality wheel. So healthy relationships are based on equality and respect, not power and control. So starting at the top, it's really important that in your relationship, there's honesty and responsibility. So what does that look like? That looks like accepting responsibility for yourself, not making excuses for your partner or your own actions, admitting when you're wrong, keeping your word, and being someone your partner can rely on when they need to. Having open communication, so those serious conversations in person and not online or text. Being able to express your feelings and opinions freely. Knowing it's okay to disagree with your partner. Saying what you mean and meaning what you say. Talking with your partner if you feel upset with them, and also problem solving. One thing I like to share when I'm working with teens is that when we're born and when we're developing, like we're learning how to communicate. And part of learning is also learning how to solve conflict. And it takes skill and it takes practice. Having physical affection and intimacy. So respecting your partner's boundaries, asking if we're acting and respecting their answer. So we're talking about permission and we're talking about consent. Respecting each other's privacy, not pressuring your partner to do something that they don't want to do. Respecting each other's right to say no. Having shared responsibilities, so making decisions together, splitting or alternating costs on dates, doing things for each other, going places or doing activities that you both enjoy, and giving as much as you receive. Fairness and negotiation, so accepting change, being willing to compromise, and also agreeing to disagree sometimes. And having respect, so that looks like paying attention to your partner, especially when your friends are around, valuing your partner's opinion, even if it differs from yours, encouraging your partner to be themselves, listening to your partner and what they have to say, and using respectful language when speaking to and about your partner. And lastly, having trust and support. So being there when they need you, wanting what's best for them, knowing that they like you, offering encouragement, supporting their goals, giving your partner personal space when they need it, and also respecting their right to their own feelings, their friends, activities, and opinions. Next slide, please. So what is dating violence? It's when one person in a relationship uses a pattern of abusive tactics to gain and maintain power and control over their partner. Next slide. So what is power and control? So the wheel that you see here is the teen power and control wheel. But this wheel was adapted from the Domestic Abuse Intervention Project in Duluth, Minnesota in 1984. And it was part of a focus group of women who were victims of intimate partner violence, also known as IPV, and they documented their most common abusive behaviors that they experienced. So around the wheel, you'll see those various tactics of abuse that was used. So like harmful language. That looks like name calling, mind games, humiliating a dating partner, making them feel guilty or insecure, telling lies or spreading rumors, or criticizing someone's identity or gender expression. And using social standing, so using popularity, class, race, gender, or their disability to manipulate them, making all the decisions in the relationship, and then being the only one in the relationship to define the roles. And so what I'm talking about here is gender roles. And like you might meet someone who has strong gender role values. And if you agree with that, that's fantastic. But if you don't, it's really important to have those conversations. And also technology. So sending unwanted text messages, breaking into someone's social networking profile, their email or their cell phone. So like knowing the passcode to their phone or continually guessing until you get into their phone. And then lastly, pressuring someone to take, send, or look at sexual pictures or videos. And using intimidation. So making someone fearful through looks, actions, or gestures. That could be smashing, destroying, or stealing someone's property, abusing a pet or a loved one, displaying weapons, or even stalking. Minimizing, denying, and blaming. So maybe they minimize the impact of the abuse. They don't take concerns about the abuse seriously, saying the abuse didn't happen, blaming the abusive behavior on stress, alcohol, drugs, jealousy, or even the victim. And using physical violence. So hitting, scratching, shaking, choking, pinching, pushing, biting, grabbing someone, or using body size or strength against them. And threats. So threats could be like making threats to use physical or sexual violence, threatening to leave and like end the relationship, threatening to commit suicide or report someone to law enforcement, making someone do something illegal, threatening to expose their sexual orientation, their immigration status, their HIV status, or other private information. Sexual abuse, so making sexual comments, giving inappropriate looks, or telling sexual jokes. Manipulating someone for sex or other sexual activity. Getting someone drunk or drugged for sex. Destroying or refusing to use birth control or STD protection during sex. And sexually touching, grabbing, rubbing, pinching someone. And then lastly, isolation or exclusion. So like controlling what someone does, where they go, who they spend their time with, who they're talking to, or even like what they wear. They could also using isolation as far as like limiting outside involvement and contact with friends and families, pressuring someone to be a part of a group, and using jealousy to justify actions. Next slide. Okay, so sexual assault is any unwanted sexual activity. So that could be sexual intercourse or sexual contact. Also, main theme here, it's non-consensual. So someone's not giving their consent. So to break down sexual intercourse, we're talking about vaginal, anal, or oral with a body part or an object. And sexual contact, so unwanted touching of someone's breasts, butt, or genitals. So with consent, we really like this diagram from Planned Parenthood. It breaks down the definition. So for when we're working with teens, it's easier to remember. So consent is like fries. It must always be freely given, reversible, informed, enthusiastic, and specific. So what does freely given mean? That means there's no threats, there's no pressure, there's no guilt tripping, there's no forcing or manipulating someone into sexual activity. It's reversible. If you give your consent and you say, yes, I want to do this, and you start to do that and you change your mind, you have every right to change your mind. You can take your consent back. Consent is informed. So do you have an STD or STI? Are you sober? Are you of age? Do you have protection? It's really important that you have those conversations and that you feel when you're asking this person that you're with, that you feel safe with them, that you trust them, that they're being honest with you, that you can have this open dialogue. Because essentially, like, that's what consent is. It's open communication where if any dynamic changes at any point in time, you have to get consent for that. Consent is also enthusiastic. So you have to know without a doubt that is what this other person wants to do. You're going to hear enthusiasm in their voice and in their body language, but you have to know this is exactly what they want to do. And the only way you know that is by communicating with them. And then specific. So when you give your consent for sexual touching, that's what you're consenting for. So like just because you consented to like touch someone's breasts or their genitals doesn't mean you consented for sexual intercourse. And again, there's different types of intercourse. So having those conversations is so important. And if these conversations make you uncomfortable, you don't have to have sex, or you don't have to do that with them. And I'm hoping that like they are respectful of you and the boundaries that you're placing, because that's really important. So if you get anything from this slide, just know that if you're giving your consent, your legal consent for sexual contact or sexual intercourse, it has to be freely given. It's always reversible, it's informed, there has to be enthusiasm, and it's specific. Next slide, please. And so I briefly wanted just to talk about reproductive coercion. So the definition of reproductive coercion is defined as threats or acts of violence against a partner's reproductive health or reproductive decision-making. So that can look like explicit attempts to impregnate a partner against their wishes, controlling the outcomes of a pregnancy, coercing a partner to having unprotected sex, which could look like withholding money to purchase condoms or birth control, interfering with birth control methods. So looking like withholding money or to purchase birth control. And then stealthing. Sometimes, having this conversation with teens, they might have heard of this word, sometimes not, depending on the state that someone lives in, stealthing is illegal. In the state of Wisconsin, it is not yet. And so what stealthing is, it's breaking or removing a condom during intercourse. And why this matters is because it can lead to unintended pregnancies or also STIs. And so when I mention giving your consent and it being informed, if you give your informed consent under the parameters that you're going to use a condom, for example, it's really important that they respect that boundary and they also respect your choice. It's really manipulating and coercive if they remove the condom or if they damage the condom in any way. But again, if you have any questions on stealthing, you can always reach out to Hope House. That's why we're here, as well as Healthfirst and even public health. Next slide. So Hope House services, there's kind of a lot on this page, but again, all of our services are free and confidential. We have a confidential helpline that you can call anytime, day or night. The number is 1-800-584-6790. It's also on the next slide. But then we provide bilingual advocacy. So we do have bilingual advocates on staff. We also do work with an interpretation line in case the services that we provide are not in that person's specific language. And then mobile advocacy, also known as outreach. So that looks like Hope House advocates traveling within our service area, providing free and confidential support to those that are requesting our services, whether that's supportive counseling, legal advocacy, or even bringing them emergency needs like toiletries and such. With supportive counseling, we do work with clients over the phone and in person, and we can talk to them about how they're feeling. Maybe they're sharing their experience with us, or maybe they're just having some reoccurring like thoughts or PTSD. So we're there for them and we're here to listen to them. With safety planning, if someone is living in a potentially unsafe situation, we'll safety plan. So what are things that they can do in their home or in their environment or even their school that can help keep them safe? With support groups, we do have groups on Tuesdays with adults. The current content is talking about gaslighting. And so to attend group, someone has to be at least 18. And then they would just either contact Hope House through our helpline, or they could even just show up. But that's on Tuesdays, and you can also check out more information on our website. With clients, we do information and referrals. So what that looks like is if a client needs housing or transportation or emergency financial assistance, we can work with them to try and speed up that process and help them qualify for their specific need. With legal assistance, so I had said legal advocacy, we do not have lawyers on staff, and we are not lawyers, but we can accompany someone to the courthouse if they're filing for a restraining order, maybe they're filing for custody of their kids, maybe there's a case of child abuse, whatever it may be, we can go with our client and sit with them during that process. We also have 24/7 on-call support for a SANE exam. So if someone was sexually assaulted, they have a right to a SANE exam. Various counties within our service area do provide SANE exams. But what that is, it's essentially a physical, but it's more extensive than that because the SANE nurse is collecting DNA and evidence. They're taking potentially their clothing, they're checking for STDs, STIs, and pregnancy, and making sure that if they had any injuries, that they treat those as well. With short-term emergency shelter, if someone was fleeing violence in their home and if they were unsafe, they might stay here. What that looks like is our shelter case manager working with them one-on-one to find them housing, to find them resources, and hopefully, getting back out into the community, feeling safe as soon as possible. And with community education to youth and adults, part of my job, and the majority of my job, is giving youth presentations to kindergartners to 12th graders. The topics vary depending on the age group, but typically we're talking about healthy friendships, we're talking about healthy relationships. We'll discuss what respect is, protective behaviors such as what's safe touch on our body and what's not safe touch. We'll go into sexual assault, unhealthy behaviors in relationships, even bullying, sexual harassment, and bystander intervention. I do have a training coming up on child sexual abuse prevention. It's called Stewards of Children in Boston on August 23rd. If you're interested in attending, the training is free, but it does take 2.5 hours, and it's only offered in person. And then lastly, Hope House was recently trained on Safe Bar, which is an active bystander training for all alcohol serving venues, which is something that we're working to connect with bar owners and managers within our community. Last slide, please. So here's Hope House's information. Our resource center is located on 720 Ash Street, right in Baraboo. Our confidential helpline is there. All of our resources are compiled on our website, as well as any upcoming events and training. So you can just go to hopehousescw.org and then follow us on social media. So at hopehousescw. So thank you. And now I believe we are opening up for questions.
Okay, if anyone has any questions, please feel free to type them into the chat question box and send them to me. And while we're waiting to see, I have a question for each of the presenters. So first for Jesse Scharfenberg, how do I talk to my new partner or tell my new partner about my STI or herpes status?
Absolutely. And I'm going to play off a little bit of what Amanda has talked about with communication. Communication is so important. So really just sitting down and letting the individual know that you want to ensure your safety and their safety when it comes to their health care and your health care, and having that open communication and that open talk. I know it can be really difficult, and that if an individual would have to disclose to another individual that they had herpes and they may not want to proceed in sexual activity or anything like that, it might not be the results you want as an individual, but it's much better than actually passing that STI on to another individual. And talk about protection methods. We talked about condom use, whether it be an internal or external condom. So even if an individual has one of those viral infections that they're going to have forever, that how do we do this safely, even though we know that there's the ultimate risk because the individual always has it. As far as with the bacterial infections, chlamydia, gonorrhea, and just letting them know, we don't like people to have the out, but if you are that uncomfortable of talking to your partner about it, Haley's going to call you and trying to get the partner information. So even if you give the partner information to Haley, she's going to contact them. She's not going to say that you were the one who gave her the information, so that they can at least get treated for the STI. It's one of those things about maturity and having trust and communication with individuals. And if you don't feel that you're mature enough to have that trust and communication with another individual, I really would encourage you to think twice before having sex if you can't have those conversations.
Great, thank you. And the next question is for Haley. Haley, are sexually transmitted infections the only diseases that are reported to the public health department?
No, they're only a small fraction of them. So what most people think of, especially right now with public health and communicable diseases, is COVID. So all of those phone calls that were being made for people that test positive for COVID, it's a similar process. I'm just calling, asking a few questions, making sure you have all the correct information. So before COVID, STIs have been followed up on by public health nurses for many, many years. Other things that would be reportable, everything from influenza, so seasonal flu. If you're hospitalized, that's reportable and you would get follow-up. Measles, mumps, chicken pox. So there are many reportable conditions that the public health department would be reaching out and just making sure you have all the information that you need about it.
Great, thank you. And the last question is for Amanda. Amanda, I know someone who I think is in an unsafe relationship. What should I do?
I think that you can start by saying, hey, maybe I watched this webinar and they talked about power control, and I'm seeing some of, these examples within what they shared, and I'm really concerned. You're worthy of feeling safe in your relationship. You're worthy of trust and respect and support. And I just want to let you know that I'm here for you.
Okay, those are all the questions I have, unless
I actually
someone
have
has a
one
last
come
one.
in on my end. So as a parent, how do you recommend talking to your kids about sex? That is, how do you know what's age appropriate when their response is stop talking about this, go away?
I can start with that one. We actually had this conversation last week as well. So whether we're ready as parents or not, I am in that age group. I have a 9-year-old to start having those conversations, but the data shows that the conversations around sex start happening on the playground around 8 to 9 years of age. So I understand that that can be really awkward for us as parents to have those conversations, but we also need to recognize what the accessibility in their environments are, not only at school, but through social media, through the internet, what's on YouTube, and empowering yourself as a parent to be the individual that communicates with your child about sex and healthy relationships, and having that conversation before they develop their own idea based on what the internet or their friends have said, so that your child, when they're on the playground or at school or in sports, wherever it may be, and they're hearing these things, they can think, oh, well, that's not true because my mom or dad already talked to me, or guardian already talked to me, and that's really not what happens. So just empowering yourself. We know that your students may not be ready to have those conversations, or they don't want to hear about it, but just letting them know it's an extremely important conversation to have, that, oh, I don't want to listen to it, stop talking about that. Throw it out there that it's going to make them feel uncomfortable, and that you yourself might feel a little uncomfortable as well talking about it, but it's an important conversation to have about their health. Another thing that you can do is continue to support your schools who are offering comprehensive curriculums. They're another way that you can reach out and, keep in touch with your schools of when you are starting to have those conversations at the school and the things, so that you can follow up with those at home and say, hey, what did you learn today about this? And start having those conversations as it's an opener for you.
I just wanted to add too, like when you start that conversation, you can say, hey, like I'm here. Whenever you want to talk about anything, please know that the door is always open. And I'm assuming you probably built that trust with them already and that they feel safe with you, but keeping that open door policy can be so helpful. And then also there's books available. I recently stumbled across the website birdsandbeesandkids.com, and she offers some really awesome tools on how to start those conversations, and even like as a parent to prepare yourself before you get ready for that conversation. So just know that there are resources available, and your concern, you're not alone. So we're always here for you too.
All right, and I believe that is the last question that filtered through on my end. Did anyone else receive any other questions? Okay, it looks like no, so we'll move to the last slide, which is our post-event survey. So like I said, way at the beginning of this webinar, you have two options to access that post-event survey. So the first is we have a QR code here at the bottom of the screen. You can scan this and that should bring you to the survey. Your other option is you can visit this link here. So that is co.sauk.wi.us/public health/reproductive-health. And then that will take you to the Sauk County Health Department webpage. And under web links, it will say, let's talk Sauk post-event survey. And that is what you would select to access it if you do choose to do that route. Upon completion of the survey, we will mail you a $15 gas card, or you can stop by Public Health Sauk County to pick it up. And we are located on the 3rd floor of the West Square building in Baraboo. And you'll indicate how you would like that gas card either mailed to you, or if you would like to pick it up, you'll indicate that in the survey. The deadline to complete the survey is August 3rd at 6 o'clock p.m. And just so everyone is aware, we do have a limit, 1 per household, and they will be mailed to U.S. Mailing addresses only. And I believe I can quick type this link into the chat. So that is the link to the webpage if you would like to access the survey that way. And then if you also choose the webpage route to access the survey, we do also have links to Hope House and Healthfirst on that page as well. And I believe that is it for the presentation. I'd like to thank everybody for coming out tonight, for tuning in. I'd like to thank each of our presenters. I think you each did an awesome job. And I wish you all a good rest of your night.